They do, and that's the good news here. So no need to panic, as you heard. According to Multnomah County, this does not mean that we're headed for a repeat of the Delta variant. But the good news is that we will have more information in a few weeks. For now, we know little about the newest variant of concern, Omicron. The variant has been traced to more than a dozen countries, but so far not the United States. One of the biggest questions going around is about how this variant affects people.
I think the first thing I would say is it's hard to say whether this virus causes more mild symptoms versus more severe disease. I think that's on the list of questions that we need an answer to.
If it is of the mild variety, some have asked if that would help us get out of the pandemic faster. According to Multnomah County Public Health Director Dr. Jennifer Vines, it's too soon to know for sure, but she expects this variant to be much like others.
I would have to believe it's true for this variant, where some people will get it and never have symptoms and never know they had it, and other people will get seriously ill.
But the good news, she says she would expect either vaccinations to continue working as they have, or they could be updated.
We have vaccines. We have a proven vaccine technology that can be adapted if it needs to be.
Vine says we are better equipped to fight this variant this winter compared to the last one.
I think we are in a much better place than we were a year ago. And my biggest hope is that we learn what we need to know about this variant to figure out the next steps, which hopefully continue us on a path forward and out of this pandemic.
So coming up, we've heard a lot of stories from you, our viewers, on how difficult it is to find a vaccine, not only for your kids, but a booster shot for yourself. Could we see more mass clinics? I have that answer for you tonight at 6 o'clock.
While they did tell me that just because there are no reported cases here in the country doesn't mean that they don't exist. They believe there's actually a pretty high chance that there are already cases here, so to please continue taking those safety precautions.
Honestly, a variant is not unexpected. This is what happens with viruses. So it's not a reason to panic.
We are concerned about this, but it's also not a time to panic. We're just gathering data. That's what we're trying to do.
Both Multnomah and Clark counties share the same message. Don't panic and keep up the good work that we've been doing so far.
Keep doing what you're doing. Folks are really taking this seriously, and it has made a world of difference in Multnomah County as compared to some other counties in the state and compared to other states.
The same things that have worked in the past are going to work for Omicron as well. Wearing masks, distancing, avoiding really crowded indoor locations where you might not know who's vaccinated or not, and getting vaccinated.
So how is the county preparing for a possible surge with this variant?
We are prioritizing kind of case and contact investigation for people who are traveling. So travel associated COVID-19 cases are going to get a little bit of a bump in priorities in terms of who we try to investigate and call and interview.
While they're still studying the impacts of this new variant, they do still recommend getting the booster shot.
We know the clock is ticking, and so the booster is going to be the thing that kind of really pushes that up to a higher level, certainly through this winter season.
The Oregon Health Authority also released a statement today saying they are concerned about this variant, but the best way to protect yourself and others at this time is still the vaccinations. To read their full statement, visit katu.com.
Right, Governor Brown's first deadline was mid-October. The unions got an extension to today. So what was the impact of that?
Deb, at least one impact is that vaccination rates went up. A union director I spoke to says it also allowed workers to not feel rushed.
From the people keeping our roads safe to those working in state prisons, Tuesday is the day they needed to be fully vaccinated or have an approved medical or religious exemption. SEIU 503 represents almost 24,000 of the 35,000 employees affected. The executive director of that union says the extension allowed people to go through the exemption process and get vaccinated if they got denied. It also allowed employees to talk to their doctors and families before making a decision. Melissa Unger is with SEIU 503.
And so the goal was just to give people all of that space that they needed. And I think likely when people take the time and have the space that they feel more comfortable with the decisions they get to make. So yeah, I think that was probably good.
Unger says there are still employees who don't like the mandate. However, she says the vast majority of them are vaccinated. Governor Brown announced the mandate in mid-August.
Today's deadline did not apply to about 8,000 state workers represented by other unions. We are trying to figure out when their deadline was or when it is. Another impact of the extension is that it likely prevented layoffs. So far, the state tells me only 99 of about 40,000 employees have been laid off.
Yeah, Deb, right now we're here at Southeast 92nd and Holgate. This is one of the deadliest intersections in the city. I wore this pink coat specifically to try and stand out. And earlier today, when we learned about those shocking numbers related to traffic fatalities, it had us wondering, is the city doing enough?
I'm one of the sergeants who also supervises the major crash team.
Sergeant Ty Engstrom is a part of Portland Police's traffic division. He regularly responds to deadly crashes. 62 people have died in crashes so far this year in the city, according to PPB. That's a number we haven't seen in decades. That's dozens of families devastated by wrecks in 2021 alone.
It takes its toll on our officers as well to see this kind of death on a regular basis.
Through Vision Zero, the city has made significant improvements, especially within designated deadly crash corridors. But then, why are we seeing such shocking numbers this year? When asked if Vision Zero is working, Sergeant Engstrom credited the work the city has done thus far, but said it's not just PBOT or ODOT or PPB that will make all the difference.
It has to be on the community to make Vision Zero work. So yeah, right now we're at 62 fatalities, and that's nowhere near zero. Setting records is not the way we want to go for this unless it's a record low. So some things have worked, but not everything.
Something clearly isn't working in Portland if numbers are this high. So we took the question to Commissioner Hardesty, who oversees PBOT, noting the alarming number of deadly crashes and wondering if she says Vision Zero is working, what backs that up? Does the city need to make immediate changes? In a lengthy statement, she laid out several of the projects she's helped launch, including the $450,000 she secured to make improvements to high crash corridors and the work she's doing to change a state law that would allow people other than sworn police officers to process speeding tickets. She says Vision Zero is a work in progress, and she believes the recent investments have helped prevent more deaths on city streets.
Now, it is clear that drivers need to be safer behind the wheel if we want to cut down on these fatalities. But Sergeant Engstrom did note it is not always drivers that are at fault. Pedestrians also play a part here. Sometimes they're the ones to blame. Sergeant Engstrom says it is important that pedestrians make sure that they are visible. I got out here and realized this pink coat probably isn't enough. Something like a traffic vest would have been better. Make sure you are visible so everyone around you can see you.